My name is Joe Balagtas. I'm a professor of agricultural economics and the director of the Center for Food Demand at Purdue University. So there are two big themes in this month's Consumer Food Insights report. The first is Americans' diet satisfaction, and then the second is Americans' diet quality and what they're doing about it. On diet satisfaction, most of us in America are happy with our diets. 83% in this past month of adults in this past month tell us that they're happy with our diets. That leaves 17% who are unhappy. Those numbers have held pretty steady over the last almost 3 years now that we've been collecting the data. So Americans are happy with their diet on average, and that's a good thing. But our high levels of satisfaction with our diets in America are in spite of our poor diet quality. We measure diet quality in our monthly Consumer Food Insights survey, and over the year or so that we've been collecting this data, 46% of American adults are eating an unhealthy diet. And of course, diet satisfaction is lower among those of us with unhealthy diets. About half of Americans who have unhealthy diets tell us they're satisfied with their diet. Again, almost half, 46% of American adults in our survey tell us that they'd like to be eating better. They recognize that their diet's poor and they'd like to do something about it. Most of those, 70%, aren't doing anything about it. And so the question is why? And we ask consumers directly, why aren't you changing your diet if that's something you want to achieve? And the two big obstacles that pop up are one, cost, a perceived higher cost associated with healthy diets, and the other is taste, a perceived lack of tasty diet, healthy foods. So for those of us who are trying to eat better, or for the public health or nutrition experts who are trying to nudge Americans towards healthier diets, these obstacles or perceived obstacles are challenges that need to be overcome. In fact, there's plenty of research that suggests healthy diets don't need to be more expensive than what most people are spending on food already. And there may be an opportunity for education to make a difference here, help people shop for and prepare foods that are healthy but also tasty for them.